The main goal is to improve patient care. We look after patients in the hospital, and when we discharge them home, there's often a period of time where they're at home and they need to get set up with their community resources. And that's a difficult time for patients. It's a difficult time, we know, because of work we've done here and what our patients are telling us. And so in many ways, this is a response to something we know about, which is a challenge in every healthcare system. It's not just in Ottawa. One is it helps identify for individual patients who we send home. It helps identify issues that they're having when they get home, that they need trouble, that they may have a need to help navigate the healthcare system. So we ask them about their medications they're taking and whether they have them and whether they're having challenges with them. We ask them about symptoms and whether or not they're having new symptoms that have come up since they got home that they're worried about. And we ask them about whether they've got their follow-up plans and everything else is organized. And if we identify any concerns in those areas, we then use that information to help. We actually have nurses making the calls, and they fix things for the person then and there.
We usually ask them if they're having any unusual symptoms or problems now that they're home, and then that probably gives me the most response. For example, someone might say, well, I'm still having pain around my incision site, so then we'll go through, I'll ask them questions like, is there any redness around your incision? Is there any swelling? Are you having any discharge coming from the incisions or foul smells? I usually call their surgeon and let them know what's going on with the patient and see if the patient can be seen in clinic. If for whatever reason can't get in touch with the surgeon that day, if they're in OR, then we'll usually refer them back to the hospital.
And the second thing is for us to use the information. What we're doing is we're collecting this information on an aggregate level, at nursing unit level and at physician level, and at department level, and then we can identify whether by looking at trends within units and within particular patient populations, whether there are things in our system that we can fix. So we don't have to rely on one-offs all the time. We can build more robust sort of preventive systems.